Hello folks, the old deplorable basket case here. I want to talk about one of my favorite subjects, the United Kingdom's National Health Service. Now, some of you are probably thinking right now, wait, why is this deplorable basket case saying this? Why would the National Health Service be his favorite subject? Well, because it's perfect. The standards of efficiency and care is just perfect to point and laugh at. I've done a video before about the National Health Service being called a national hangover service by people who are working in the NHS. But I read a few articles recently that really, well, I'll just get into it. So, England, Scotland, and Northern Ireland have slightly different regulations. For example, the maximum waiting period that people are supposed to be waiting for routine operations, it can be different from England to Scotland to Northern Ireland. In England, for example, I read that the maximum waiting period is 18 weeks for someone to have surgery done on their knees, routine surgery, various things that need to be done but are not urgent, that should be scheduled. 18 weeks is the maximum legal waiting period. People are waiting months and months and months for routine operations, not long involved things that would require a great deal of resources to accomplish. And when people are forced to put off the medical operations, it can have a really bad effect on their health. But you think getting into a hospital is a chore? Try getting out of one. Outpatients are not getting out. People are supposed to be leaving hospitals to go to assisted living facilities or places for long-term care, or just out to get back to their lives, are being kept in hospital for days, weeks, months, in some cases over a year after the date they are supposed to leave. Now, many people who are involved in the National Health Service blame a lot of other people who are involved in the National Health Service. A lot of people blame each other. So, no. I'm not saying that a National Health Service cannot work. I'm not saying that a National Health Service cannot provide the citizens of a country the service that they need. I'm saying that this National Health Service doesn't work. And, well, I'm not English or British or Scottish or Irish. I'm not British. I don't live there. I don't have to live with the thing. I'm just pointing and laughing from another country. So, it's not my place to say what the British need to do to make an adequate National Health Service or some free market alternative. But as a suggestion, make a free market alternative. Israel has a free market that is a free market health service, health industry, that is closely regulated by the government to make sure that there is adequate service for everybody in the country. It's a sort of a hybrid between socialism and capitalism, and it works very well here in Israel. Now, I doubt that what works in Israel would work in Britain, but there are things you can do. There are ways to make sure that everyone gets the health service that they need, that work. So, good luck, Britain. And I sincerely hope that everybody in Britain gets the health service that they need. That's all. Thanks for watching. Good night and God bless.